Hi, I'm Susan Taylor with Scripps Health in San Diego, California. You're young, you're active, you're running, riding your bike, playing tennis, softball, baseball, basketball, soccer, and then you take a fall. Here to talk about common knee injuries in young active patients is Dr. Tim Wang. He's an orthopedic surgeon with the Scripps Clinic Medical Group in Oceanside, California. He specializes in sports injuries. Dr. Wang, thanks so much for being with us.
Pleasure being here with you, Susan.
All right, let's go over these common knee injuries. What are they? What causes them, and how do you treat them? Let's start first with knee ligament injuries.
Knee ligaments are the attachments that go from bone to bone. There's four major knee ligaments in the knee: the anterior posterior cruciate ligaments, those are deep inside, as well as the medial collateral and the lateral collateral ligaments. They can be damaged just as a sprain, or they can be complete tears, depending on how severe the accident is.
So what happens if you have a ligament injury? How do you treat that?
So depending on the type of ligament tears, oftentimes the good news, though ligaments on the outside can heal on their own. The ligaments on the inside, in particular the ACL and the PCL, have limited healing capacity. And depending on the overall examination of the knee, the patient's activity level and goals, and for sports, something that may require surgery if they want to get back to an active lifestyle.
And what's the recovery time from that surgery?
The most common knee ligament that we treat surgically is the ACL, or the anterior cruciate ligament. Fortunately, that surgery is performed as a same-day outpatient procedure, about an hour to an hour and a half. Patients are able to go home right away. In most circumstances, with an isolated ACL injury, patients are able to walk right away, bend their knee right away, and we get them to physical therapy within the first week.
And what about meniscus tears? Show us what those are.
The meniscus is the shock absorber that sits between the bones. There's one on each side, the medial and the lateral meniscus, that serves as a shock absorber or cushion to help absorb the impact between the bones. That can get damaged either from an accident or through wear and tear over time. The meniscus can get injured, particularly with twisting and turning injuries. Unfortunately, when the meniscus gets injured, it doesn't heal on its own. So if patients still have pain and limitations in activity because of their tear, that's when we sometimes would consider or recommend surgery to treat those.
Is that also outpatient surgery, and what's the recovery time on that?
So meniscus surgery is outpatient, and it's done arthroscopically, which means we use our little microscope and minimally invasive instruments to get access to the meniscus. Depending on the severity of the meniscus, if it's a clean rip, sometimes we can stitch those together. In other circumstances, if it's more shredded or a more severe tear, sometimes we smooth it out and trim it. The rehabilitation and return to activity really depends on how bad the tear is, with 6 weeks for full activity for a simple tear, anywhere from 3 to 6 months if it's more complex, or if there's a complicated stitching that has to occur.
And what about patellofemoral instability? What is that?
One of the most other common knee injuries that we see, particularly in young women, teenagers, and other school-age students, in which sometimes the kneecap can actually pop out of place and dislocate, and sometimes pop back. That can lead to an issue with pain, instability, and not trusting the knee. And when that happens, patients and athletes can be very limited in their sport and function. In worst case circumstances, can have patients give up the sport that they love to do. We now have better tools to be able to reconstruct these ligaments, provide greater stability to the kneecap, as well as allow patients to get back to sports, exercise, activity, as well as their day-to-day goals.
And what's the recovery time for that surgery?
Yeah, so good news for this too, Susan, is that this is also performed as a same-day outpatient procedure, as many of our things are in sports medicine. A lot of our patients are itching to get back on the field and have the next edge in terms of competition recovery. With this kind of procedure, patients are able to weight bear and walk right away, start bending it right away, and work on strengthening after just a few weeks.
And what about articular cartilage preservation? What is that?
Yeah, so I think that's the next real forefront for where we are in orthopedics and sports medicine. So again, if you look at our model here, all of our joint surfaces are covered in what's called articular cartilage. That's the end of the bone on both sides of the lining. That can get damaged either from an injury or accident or from wear and tear over time. We now have some more state-of-the-art treatments in terms of either filling in some of that damage or even reversing it. Not everybody's a candidate, but the patients that are best suited are young, active patients with what we call focal or pothole lesions instead of diffuse or full areas of cartilage loss.
And talk about this new incredible Bayer ACL procedure. I know that you were the first surgeon in San Diego County to perform this procedure. What is it and what does it do?
Yeah, that's right, Susan. That's something that we're really excited about. This Bayer implant is a procedure that we're really looking forward to seeing the results for. It's designed for injuries of the ACL. That's the anterior cruciate ligament deep in the middle of the knee. Unfortunately, we know that historically the ACL doesn't have healing capacity on its own. So the standard of care for us in surgery over the past few decades has been reconstructing or building a new ACL, either using tissue that we borrow from somewhere else in a patient's body or a donor or a cadaver graft. Based off where the ligament is in the knee, the location would prevent it from healing on its own. With the Bayer procedure, we're able to now support the healing of a patient's own ACL, their native ACL, with a little collagen sponge. It's about the size of a marshmallow. I actually have one right here. So it's about this big. This serves as somewhat of a scaffold for the patient's own ACL to heal. It supports the clot and the scar tissue to allow somebody's own ACL to heal naturally without the need for borrowing tissue from somewhere else or using a donor or cadaver ligament. Our research is still ongoing, but thus far we're really excited about the potential for healing and for recovery.
Does that speed up recovery time, this new procedure?
In comparison to the standard of care, which is borrowing tissue, either from the quadriceps, the patellar tendon, or the hamstring, the early recovery is much faster because we're not making patients weak right away. They start out with all their normal muscular strength. They don't have to work in the first few months to recover the strength that they've lost from the standard of care, which is the ACL reconstruction.
Doctor, you've taken care of a lot of professional athletes in your career. You've taken care of the Golden State Warriors and the Brooklyn Nets, those NBA players. You've also cared for Olympic athletes. What can an active person do to help prevent these knee injuries?
Well, I think you hit the nail on the head there, Susan, is that the goal is all about prevention. And all of us are at risk for knee injuries if we twist the wrong way, if we stumble or have an accident. The best way to prevent that from happening is to ensure our muscles around the knee are strong and can protect us like a seatbelt or an airbag in case of an accident. Those include the muscles around the knee, so the quad and the hamstring, but also the ones above and below the knee, so your core, your hips, your glutes, as well as your ankle and your foot too. A basic conditioning program for all of us for maintenance is helpful to keep us strong, active, as well as prevent injuries for the future.
If you experience any of these knee issues, when should you go see a doctor?
The good news is most knee injuries can be treated at home with our acronym RICE therapy. That's R as in rest, I as in ice, C as in compression, and E as in elevation. Sometimes some over-the-counter anti-inflammatory medications can help with this as well. That being said, there are some circumstances where it would be prudent to go check in with a doctor in urgent care on a sooner rather than later basis. And that would include situations where you had an injury and then you either feel a pop in your knee, you have a lot of swelling where it blows up like a balloon, or it becomes very painful and you can't put any weight on the leg. That would be a good indication to get checked out.
Any final thoughts, doctor?
Susan, I think we're just really excited for all the forefront of innovation and technology here in orthopedics, particularly in sports medicine, our treatment for ACL injuries, articular cartilage injuries, and meniscus damage. We have a lot of options now that we didn't have just a few decades ago. And we're really excited about the opportunity to take care of our patients and athletes and keep them going for now and the years to come.
Dr. Wang, thanks so much for being with us. We appreciate you taking the time.
Always a pleasure.
If you want more information on these common knee injuries and how to treat them, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.